Good evening. My name is Reverend Terry Troya. I'm the president of Project Hospitality. And Project Hospitality's mission is to serve Staten Islanders who are hungry, who are homeless, and other people in need. And that is exactly what we have been doing since early March of this year, in the midst of the COVID pandemic. All of us have been out on the streets, serving homeless people in ways that you cannot imagine, reaching out to them to be sure that they have the information they need and the tools they need to avoid getting this transmission of virus and taking it to other people. We're here for people who are vulnerable and in their houses and cannot get out to shop or afford to pay for food. And we are delivering food every day of the week somewhere on Staten Island, as well as distributing food in parts of our community that have been so very much affected economically by this pandemic, where people are receiving checks that are not making the rent and putting food on the table, and where people are receiving no checks at all. And so we're here to serve, and we're here to celebrate that service in what would have been our Harvest Gala tonight, but instead is our Harvest Tribute. So we welcome you this evening and ask you to take a deep breath and join us as we say thank you to people who have worked tirelessly, courageously, fearlessly, and without concern to their own self in order to save lives. We honor them tonight, as well as those who have fallen in the path of COVID. Welcome to this harvest of courage.
Hospitality House is a family shelter. We're the only family shelter on Staten Island. So it's moms, dads, and children. And I actually met Gail there. She was there before me, and I met her as a family monitor. Within my first year there, she had expressed this desire for cooking and wanting to be in the kitchen. And I just remember her tenacity at that time. She had to study to take the food handler's license and transition over. And sure enough, she did it. And so really, for 4.5 years, she was in the kitchen.
Gail was so sweet. And we used to have nicknames for each other. I called her Gaily Girl, and she used to call me Sherry Berry. And this went on for years. Every morning I used to walk into the kitchen. I was like, Gaily Girl! She's like, Sherry Berry! Yeah, we had a nice connection. She was a lovely woman.
The kitchen is not going to be the same. I don't think it has been the same. We don't have a staff that's replaced her. I mean, I think she definitely had a presence. And in the beginning, when she got sick and she wasn't there, all the residents were like, where's Miss Gail? You know, and that's tough because staff know that she's not well, but you're not able to share that, especially when you don't really know what's going on, you know. Hospitality House is like a family. And so whether you're on the family client side of it or the staff side of it, it's one big family. So you're used to seeing someone every day, and then all of a sudden you don't see them and people aren't maybe sharing about them or talking about them, you start to feel concerned, you start to wonder. So I think as soon as she wasn't there, she was missed. She was definitely a listening ear, definitely a source of encouragement, always had a friendly face when the families came downstairs, almost kind of like maybe like a grandma. If you've had the chance to experience her, then you know the void.
The one thing I remember most is that smile. She had some smile on her face.
Ed Latourette was a very different type of teacher. He used kindness and listening as disciplinary tools. He taught tough classes. He had a lot of our kids who were struggling to achieve, But he was able to reach these children more times than not, and was also someone who was never afraid to learn and never afraid to try new things. He really was different, and the kids sensed that. Teenagers are incredibly good readers of adults. If they're in the presence of an adult for 30 seconds, they already have a good idea of what the person's like. Unfortunately, it's a skill we lose as we grow older. So they always sensed from Ed that this was someone who was in their corner and someone who cared for them. And that was how he used discipline.
So I called Dom my skipper. Had this way about him that just always made you feel like you were out on the ocean and that anything could happen, and that if you met it with an open heart and if you showed up with a positive attitude and if you believed in people and the beauty of people, that anything could get done. And for 15 years, I had the privilege of working with him, and he just allowed, I'm not even sure that if it's allowed, just the way that he was, the team was able to do so much. We were about ready to honor Dom for our 50th year as an organization, and as sort of a proper hail and farewell. Obviously, it was postponed, and he passed on the day of the event, the day that the event was supposed to occur. And there was something a little comforting about that, because that day was meant for him, and it was really heavy. And at the same time, I knew that with everything that had happened up until that moment, he was ready.
When I reflect on what Mary Ellen meant in the hospital, in the community, greater, okay, she was kind of quiet hero. When people hear me use the word quiet in relationship to her, she'll probably, people will laugh. She's probably laughing right now. When I use that word in reference to her, what I mean is that she did the very best she could, and no matter what circumstance she was in. And as a result, that reverberates into the community in general. Good care in a hospital means that patients in a community are healthy, and there's a lot of patients and families that Mary Ellen touched through her years, her career as a nurse, and particularly her career as a nurse at our hospital. Very little that you could ever ask that she wouldn't be able to do and do it well. I think she had a special affinity for people that struggled. Those are the people who didn't have anyone. Those are the people that Mary Ellen would step forward, and she would, with sheer determination, make sure that they got what they needed. And I think that was a special gift to those people, and a special gift that Mary Ellen had that she imparted to them as well.
I'm really moved to tell the story of Anthony Aracey tonight. A native Staten Islander, Anthony was an NYPD detective and then served in the FDNY. He gave of his life day in and day out in serving our New York City and Staten Island community. A native Staten Islander that came right out of St. Peter's Boys High School, like my dad did, and went on to the College of Staten Island to marry his childhood sweetheart, Melissa Kelly, and to raise two beautiful children, Anthony and Alexa. He was dedicated to island sports, especially at St. Rita's Church and the Staten Island Mid-Island Little League. He was a person just like a neighbor to the left or to the right of us. But like other 9/11 responders on Staten Island, he died of COVID, and he died young at the age of 48. We thank Anthony Aracey for his long service, for his gracious spirit, and we pray comfort for his family in their time of need.
Father Joe Murphy, legendary pastor of St. Clair's in Greek Hills, who brought that parish alive. An interesting priest. And before he went into parish ministry, he attended a 3-month seminar somewhere in California. I forget the name of the seminary. And that was to prepare him for the responsibilities that were to come. He admitted that it changed him. It changed him in such a way that he saw parish life in an entirely different way than what he was accustomed to. And I remember many, many years ago, when I was a young priest, he told me the secret of pastoring is service. The secret of pastoring and the power of pastoring is empowering others and letting go. Joe Murphy was the kind of a guy who didn't sit in the rectory for people to come to him. He went to them.
He was a man well before his time. He was the one in the beginning that started everything because he saw, he knew what was going to happen. Well, he foresaw what was going to happen, the lack of clergy and all, and that's one of the reasons why he started to bring the people in and get them active in the church. Most people feel when we lost him, we lost part of ourselves.
Father Richard Guastella, we lost a giant on Holy Thursday as he fell victim to COVID-19. A priest's priest who spent his entire priestly life in parishes. What a successor to Monsignor Joe Murphy. They couldn't have found anybody who was better. He took what Monsignor Murphy had developed and he expanded it, he enlivened it, he brought it to new heights. The parish became this center of activity, of welcome, of evangelization, of social service, of meeting the needs of not just the people of St. Clair's, but the entire island.
He loved being a priest because being a priest enabled him to be a father to thousands of people everywhere in Ethiopia, in Africa, where he ministered. Here in Staten Island, in New York City. To me, that intimate relationship, that's what he enjoyed the most. And it was no surprise to me that when he died and we were getting calls and emails after emails, I got hundreds of emails. And the theme in all of them was, he was not a priest to me, he was a friend, or he was a father. That's who he was. After Father passed, my own father, who's an excellent dad, so when I refer to Father as a father, it's not because I don't have a good dad. I have an excellent world #1 dad. And when Father passed, my own father called me and he said, I know you are mourning your dad. Because they all know who he was to me and what he meant to me. I still don't get it.
When I think of my friend Maggie Howard, I realize that I was blessed beyond measure. No, we were all blessed beyond measure because God had bestowed upon us a precious treasure, a rare gem, and allowed us to bask in the brilliance of her spirit. Maggie was a phenomenal woman, the manifestation of all that's right and good in this world. Feeding, clothing, and ministering to all who came in need. She had a selfless and giving spirit. When Hurricane Sandy hit Staten Island and devastated many communities, Maggie went into communities that greeted her with much trepidation. Undaunted, she traveled to the South Shore every day to help those whose homes were destroyed by the floods, bringing them food, water, and clothing. I will miss our 6 a.m. calls, hearing her laugh, calling her, asking her to pray for me and with me, and just the ability to bask in her goodness. Maggie was light and love personified, and she will be sorely missed. But I find solace in Matthew chapter 5, verse 8. Blessed are the pure in spirit, for they shall see God. And I know that Maggie has arrived home to take her place with all the other saints. I love you, Maggie.
She got me talking about my life story, you know, and like I elaborated on it and everything. And then she was like, well, it's going to be a pleasure of having you here. And we took it from there. You know, it wasn't much. And, you know, we talk every day, you know, just conversation every day. When I first got there, she could barely walk. I used to help her with that. Walk with her every morning, every evening, every night. Whenever she needed, it's like I was her crutch. If she needed something done, I did it for her. And like I told her, I said, as long as I ain't got to fly or go on water, I go for you. But she was a very strong-minded person. She the one gave me the courage to go to church and everything. She the one gave me the courage to push on the way I'm pushing it now. She was like, Joe, you could do it. I got faith in you. And I'm still here. You know, people I done seen and left, and I'm still here. So I gotta live out her legacy.
Project Hospitality would just be a concept without our dedicated staff. They ensure that our clients are fed and supported, whether they are homeless, in one of our residential sites, or in private apartments. These staff keep our sites and offices operating, and they do it all in service of the most vulnerable of our community. For almost 40 years, Project Hospitality has demonstrated unyielding devotion to those in need on Staten Island. But it takes a crisis like the one we currently face to see the depths of our staff's commitment. Hello, I'm Carrie Bloss. I have the great honor of serving alongside the dedicated staff and volunteers of Project Hospitality as Executive Director.
So in a typical week pre-COVID, served about 700 households per week. But we've seen double the number of people.
People are going through hell right now. We all know it. We're seeing just the space of weeks. People's lives have been upended. We've never seen anything like this in generations. And every one of you has answered the call. So from the bottom of my heart, first, most important message, thank you for all you do. God bless you for all you do.
Our more than 400 staff members and so many of our volunteers have not stopped working since the pandemic began. Our agency learned of our first COVID-19 case on March 16th. Within days, clients in 2 of our congregate care settings were starting to show symptoms, but the city had not yet developed a plan for isolating homeless individuals. We were persistent, and by that night, the city had secured hotel rooms for our use. Project Hospitality staff was nothing short of amazing. They quickly developed a plan to support the clients who remained in isolation. We brought them food and medicine, helped them monitor their symptoms, and supported their mental health. At the same time, staff continued to operate existing programs, just as they had leading up to this crisis. Over the next months, COVID struck our other 24-hour sites and our food pantry, and in each case, services continued. Thousands of people were fed. People were brought in off the streets. Our behavioral health specialists provided emotional support, and we moved new households into our permanent housing. None of that work happens without the commitment of our staff and volunteers. At Hospitality House, we provide emergency shelter to 46 homeless families, 24 hours a day. But residents here receive so much more than just housing. The program prepares 3 hot meals per day and offers on-site childcare. Our case management staff work one-on-one with clients to address individual needs, and they cut through red tape to connect families to stable housing. Our clients' challenges have always been great, and they were only magnified by COVID. Still, staff have not relented. Wearing masks and protective gear, they continue to come in to work. Despite every barrier, we placed 17 households into permanent housing between March and June. COVID has presented challenges for all of us, and this has been particularly true for the street homeless. As restaurants and stores closed to customers, the homeless were left with even fewer public restrooms or places to wash their hands. Our outreach teams continue to be on streets of Staten Island, engaging the homeless. We have given out hundreds of masks and bottles of hand sanitizer to those who would otherwise have no protection. We also partner with 7 houses of worship on Staten Island to provide a total of 68 beds where street homeless clients are able to sleep in tranquility. Volunteers stay overnight at these locations to provide safety and support. This winter, the late Reverend Maggie Howard and Stapleton UAME Church partnered with Project Hospitality to create a shelter for day laborers, which has welcomed those in need every night since opening. Our staff continue not just to serve, but to innovate. We have experienced a 37% increase in the number of people seeking emergency food from our food pantries and soup kitchen. Staff members developed plans to continue to meet our community's needs while keeping everyone safe. In our soup kitchens and food pantries, we have put into place new protocols to ensure social distancing as we provide the essential food and nutrition our community depends upon. I have been overwhelmed by the compassion and dedication of our staff and volunteers across our programs. They are the human embodiment of our mission. They clean our residential facilities and offices to ensure that clients, staff, and volunteers remain safe. And they do all of this wearing masks, trying to show smiles that are now hidden from view. But despite exhaustive safety protocols, staff and volunteers know they could be exposed to the virus when leaving their homes. When so many New Yorkers have stayed home, they come to work. Our heroic frontline staff and volunteers could not do what they do without you. Thank you for being our partners in this vital work. Your support, involvement, and generosity allow Project Hospitality to care for our neighbors in this unprecedented time of need.
And I have more recipient now since we had this COVID. Right now, we are in crisis. On a Tuesday night, we have more than 200. If we don't have enough, we divide it so that everybody could have something to take home. I'm serving my church, and it's my devotion. It's my commitment to the world.
At the beginning of the pandemic, I started hearing not only how much the population lining up was growing, the amount of work became so heavy, and a lot of the volunteers did feel afraid at the beginning. They did feel the fear of working through COVID, and they have done an amazing job. We were able to recruit a total of 43 volunteers at this point, which are all El Centro volunteers. A lot of people live paycheck to paycheck, regardless of their immigration status. That doesn't really make a difference. However, once COVID hit, unemployment also did. A lot of people needed help with finances, utilities, rent, food. So the need just kept growing, and we tried to address every one of those needs. I've seen heartbreaking stories. I've seen families that are really struggling right now, not only through mourning, but also how do they move on from here? How do they continue? My heart really goes out to the ones that have lost a family member, because everyone else can recover. We can find other ways for employment. We can find new ways. We can find a new home, but there's nothing that can replace the loved one.
I serve the soup kitchen. I help out with the pantry. You know, I bring the food for the pantry. And then they started this shelter thing at nighttime. So Miss Troy asked me would I mind staying overnight with some guys. So I stayed with them the first couple of nights. Everything was cool, was smooth. And after that, I've been doing it ever since. And I enjoy doing it. You know, keep me out of trouble. And it give me something to do. At the same time, I'm helping somebody. You know, I'm helping somebody, you know, need a place to stay. I'm helping them. I'm doing God's work. God said, "Would nobody want to do it?" Then He gave me a sign and said, "You was the man for the job," and I took it, and everything was smooth. I like what I.
In the absence of having some kind of public service announcement to the level that I was looking for, that doesn't mean people didn't, elected officials or community leaders didn't offer information, but I was looking for something really readable for everyday people, really simple that everyday people could follow so that they could also get on with their regular lives and not have to read through 4 pages of Office of Emergency Management direction. Fine print. So that's why I started this resource network, because I just wanted easy to digest, everyday information that gave practical advice on what stores are open, what do you do if you can't get out, what do you do if somebody's sick, how to contact a doctor. And I used a lot of information that was coming from officials also, but it was a bit too like I say, it might have been too detailed to digest all in one spot, so I tried to distill it down and just issue regular bulletins. And I'm happy that a lot of people found benefit from it leading up to now. I really wanted people to engage and help each other, and they did, and they are.
I'm an American. We help. I'm an Episcopalian. We help. I'm a Mason. We help. So, and it's not necessarily in that order. That's why I help. Now, prior to COVID, originally I would get maybe 6 truckloads a week. And it'd be all mixed goods, some of this, some of that, some of the other. And it was all hand load and hand unload. But since the advent of COVID, I'll bring, well, up to 12. Well, even one week I brought 15 pallets of food. And it's a case of the volume is increased more than tenfold. Plain old down to earth. If somebody's hungry, get them something to eat. Disaster's not new. We just have to be resilient, we have to be compassionate, and we have to think of others, and we can make the world a success. I'm just a volunteer wherever it's needed, whatever needs to be done. I got a pickup truck with an 8-foot bed. It's 17 years old, and the truck's old, I'm old, but we both still work.
Nurses have stepped up.
very often in conditions where they knew that they didn't have the right protection, and they were literally putting their life on the line to save others. And they were also, heroic, but also very scared, and oftentimes very scared for their families. Very worried that they would become vectors for this infection and take this infection home to their families. Many of them chose to stay in hotels, and it actually took a long time for us to coordinate places for a lot of the nurses to stay. That really felt like it wasn't safe for them to return home because they had family members that were really vulnerable. But it was an experience that, has left a lot of scars on a lot of our nurses, and it's going to take a long time to heal.
I was the command center. I was the incident commander for the first 3 weeks of COVID. We would do 7-8 days on, a couple of days off. So early on in the COVID epidemic, we basically changed the way we did business at a Staten Island University hospital. The amount of patients that we saw that were coming into the emergency departments and into our hospital COVID positive was tremendous. And we had to change everything that we did. And I was in the epicenter of that at SIUH, changing med-surg units into critical care units, opening up beds where beds never were, managing the testing, managing you name it. We did it at Staten Island University Hospital, and we were the core of that.
What motivates me is my passion to help others. That is why I chose the profession of healing. One of my mission is to help the marginalized populations that are so much in need of and often so far away from quality health care. In New York City, it has been reported that Black and Brown Latino communities have been hit harder by the coronavirus and with fewer resources to save them. This has been tied to health disparities and structural racism.
The strength of the families living through this, unable to see their loved ones early on in this pandemic, and we were having phone calls with them and FaceTiming them and getting them a last word with their loved one, and how they lived through it, and just the strength of everybody through this. People really rose to the occasion.
I thank God for giving me the strength to do what I do every day, and I know I'm made for this. And I know I have made a positive impact towards every patient.
Thank you for joining us for our tribute to Staten Island's COVID frontline workers and fallen leaders. Thank you, Brian Leyline, who chaired this tribute, and the Kelleher family, and those Staten Island sponsors who made this event possible. We hope this glimpse into our life-saving work will inspire you to donate to Project Hospitality and to join us as volunteers in our critical work, sheltering and feeding our neighbors in need. Thank you for your support.